statistics tells us that 51% of Gambian population live in urban areas. It's 49% in the rural area. This has implications for development. Are the urban centers ready to absorb all this population and educate them and make a profitable and a productive manner? Who is going to maintain the rural economy if people are migrating? These are all fundamental questions that needs to be addressed.
The Deputy Permanent Secretary, Ministry of Finance and Economic Affairs, highlighted government's drive to collectively achieve targeted national and millennium development goals, which prominently include education and women empowerment.
The government has done a lot to avail the women the opportunity of what is called empowerment of women, that is goal 3.
The rationale behind the National Youth Consultation on Post-2015 Millennium Development Goals is to create a forum for awareness and creating sound recommendations. This participant shared his views with GRTS.
Globally, looking at the population demographics, you can see that there's a higher percentage of the world that are actually young people who were not actually at the table back in 2000 when these things were charted. Today, what we are doing here in the Gambia, as it's happening in many other places, is the young people giving their opinions, saying exactly what do they want to see in 2015. And I'm glad that we have national youth organizations, we have young people from different regions who are here to say exactly what future they want in 2015.
The president of Young People in the Media said she will use her radio show to spread the information and lessons learned from the consultation wider audience.
I never knew that like environmental sustainability was among the MDG goals, but right now I realize it, and I'm having a radio show. But if I also go out there, I'll try to sensitize other people how it is important to conserve the environment, how it is important to make sure the environment is clean, and then to give a message to people that are sitting out there, our representatives, that we want to have a clean environment after 2015, and we don't want hunger, and we want to have quality education to them.
Given her commitment to the achievement of the Millennium Development Goals at the United Nations-sponsored Millennium Summit in 2000 and her large youth population, the National Youth Consultation on Post-2015 MDGs may serve a pivotal function in engaging youth in development and decision-making. For GRTS News, this is Pavukar Senghor.
Meanwhile, health personnel at the Jame Foundation for Peace Hospital have been assessing the progress registered so far by the authorities, this as the international countdown on the Millennium Development Goals begins. Ibrahim Balde has that story.
For Sabtu Suwane and her colleague nurses at the Jame Foundation for Peace Hospital in Bundung. The peak periods are usually during weekdays when the demand for healthcare is ever challenging. With 2 years to go before world leaders reconvene with a view to looking critically at the progress registered, we went out and about to gauge the reactions of the health workers about UN MDGs.
As far as we are concerned here in Jame Foundation, we are working towards achieving the Millennium Goal 4 and 5, which is the reduction of maternal and neonatal death. Yes, at the moment, there are ongoing trainings, there is capacity building, ongoing training on infection control, care of the newborn, maternal emergencies. We're doing all that to try and find ways of cutting down on maternal death and neonatal death. So there is that ongoing training going on amongst us here in the hospital. And sometimes the ministry they do organize workshops based on those training as well, maternal and neonatal child health. They're doing that to see that we achieve Millennium Goal 4 and 5. So we are working towards that, and we hope to achieve it by the year 2015.
Optimism is the buzzword here, and Sabtu added that a lot has been done, arguing that she was optimistic about our commitment to achieving the UN MDGs.
We're working towards achieving MDG 4 because our maternal death rate has reduced, neonatal death rate is going down because of the ongoing trainings, commitment, and the like.
The Gambia has over the years witnessed unprecedented developments in the health sector. With the Dongoroba Health Center in focus, many believe the more the merrier. Sabtu added that the construction of health centers in rural communities would undoubtedly help ease the pressure from patients who travel to the city for medical treatment.
So with the increased number of health facilities in these villages and catchment areas, it will go a long way in reducing the workload here, because instead of patients coming all the way from Fonyi with health problems, they can be rather seen at their various facilities. If they cannot manage those conditions or health problems, they can be referred to major health centers or hospital, the main referral hospital Banjul. Or Brikama, even Brikama, they are doing operations now. So it will go a long way in cutting down the workload here.
The MDGs are the most successful global anti-poverty push in history.
At the United Nations, Secretary General Ban Ki-moon's statement is meant to spur member nations to move faster and deliver on their promises to reduce poverty and improve the health conditions of the peoples.
World poverty has been cut in half. More girls are in school. Child mortality has dropped. We are fighting killer diseases. The list goes on, but too many women still die in childbirth when we have the means to save them. Too many communities still lack access to sanitation. Too many families are still being left behind. We have 1,000 days to close the gaps, 1,000 days to accelerate action. Here are 4 ways to step up our efforts. First, scale up success through strategic, targeted investments in health, education, energy and sanitation. Above all, by empowering women and girls who can boost results in all other areas.
It's not going to be easy, however. With hard work, these goals could be met even before 2015. Well, normally hospitals in sub-Saharan Africa are almost overstretched with the sheer number of people who on a daily basis knock on their doors to receive treatment. The situation might not be as different from that of Jammeh Foundation for Peace Hospital, where we understand the numbers are also increasing as a result of the services being provided here. The good news is that the nurses here are also optimistic about the chances towards attaining the Millennium Development Goals, which concerns health. Ibama Balde reporting for GRTS at the Jammeh Foundation for Peace Hospital in Bundu.
A staggering 860,000 people die of malaria in Africa. We examine how malaria remains #1 killer disease on the continent. We'll be back with this and other stories right after this break. Welcome back. Efforts to fight to contain malaria are showing no signs of relenting around malaria endemic regions, especially sub-Saharan Africa, where thousands of people die as a result of malaria-related illnesses every year. As we hear in this moving documentary entitled Fighting Malaria, the documentary focus on the colossal sum of money being spent to rid the continent of malaria.
A tiny, single-celled organism in the blood vessels and livers of human beings. It's a serious disease that disables and kills more than 860,000 people every year. Though 40% of the world's population live in malaria endemic regions, the majority of related deaths occur in sub-Saharan Africa. Despite medical advances, the disease continues to be a problem. It is estimated that every 45 seconds, a child dies from malaria in Africa. But there is hope that one day malaria will no longer burden the people of Africa. Angela and Regina both have daughters infected with malaria. These mothers have come to the Shampande Clinic in southern Zambia to receive medication.